All right. So thanks everyone for joining our 10th AMA, if you can believe it. This is our Ask Me Anything series where we have a student author recently published come talk a little bit about their research, but most of this will be about kind of the challenges and successes of publishing and some of the behind the scenes. I think Matt's going to provide a really interesting take because he studies, or this paper at least is about wearable sensor data. And I think that's all the rage right now. And he'll talk a little bit about why that creates some additional challenges as well. So he'll give a little bit of a talk, and then hopefully at the end we'll have some time for discussion or question and answer. And then at the end, I'll also stop the recording. So if you want to ask a question but not be recorded, you can go ahead and do that. All right, Matt, you can go ahead.
Yeah, so thanks everyone for tuning in. So I'm a PhD student at McMaster University, so just jump right in. So I'll start by just talking a little bit about myself and then the background and my research interests. I'll do a little bit of the overview of the paper and then kind of do some like behind the scenes stuff talking about, like how we actually came up with the idea for the study and data management, a little bit about revisions, and then little lessons learned and writing tips for putting it all together. So my, I guess, like journey began at St. Louis University, where I graduated in 2011 with a degree in biomedical engineering. Right after I went to UC Davis in California, I worked in a highway safety lab doing some statistical modeling of different highway zones, trying to like identify factors in crashes and all that kind of stuff. Not really, like I like to say it was tangentially related to biomechanics, but like not really overall. But after there, I went to Harvard and didn't go to Harvard, but was working as a lab engineer at Harvard with Irene Davis in the gait lab there, doing running gait biomechanics, and eventually got into looking at wearable sensor research because we had a big study with the Boston Marathon monitoring runners during the course of the race, which was a really interesting study, and love to talk about that more if people are interested, but that was also quite the endeavor. After a few years there, I moved to Henry Ford in Detroit and did a bunch of shoulder related, like rotator cuff related research, where we also were looking at specifically at biplane, but we also did I got a little bit into wearable sensors there as well. And that's kind of like where I after like those two experiences decided that I wanted to go back and do a PhD, and specifically looking at wearable sensors, and getting to some little bit of markerless experience as well. So just a little bit of background on kind of like what the kind of my research area. So I do osteoarthritis research. So just we'll give a little bit of an overview. So it's a degenerative disease that affects the joints, with the knee being the most common. And so millions of older adults are affected by osteoarthritis, which results from changes in the bone and tissue, which over time increase pain and decrease function and quality of life over time. So at a certain point, it gets bad enough that patients often get a joint replacement, with the total knee arthroplasty being the like end stage treatment. So ways we can monitor this potentially would be to use an in-lab gait analysis. However, these are expensive, and so you monitor the changes in gait. However, these are expensive to maintain. Just the equipment's really expensive. You have to have personnel to run it. And so it's not practical to have these in a lot of clinical spaces. However, we're trying to transition from our markered gait lab to a hallway markerless gait lab where we can basically bring our patients over from in clinic and just have them walk through the hallway, and then we can get their joint biomechanics. And then we can also potentially use wearable sensors to measure gait analysis as well. We can do that outside the lab or inside the lab. And this has been a increasing area of this has been an increasing area of research within osteoarthritis in clinical use. However, there's still issues with the wearable sensors, namely so like if you think about it in terms of like you have the in lab data and your out of lab data, it's almost like a spectrum, right? So we know that the free living data from the sensors is going to be has generally been shown to be different than the in lab. With your in lab data, you have essentially a higher volume of data, or sorry, a higher quality volume of data, whereas the out of lab you have a much higher volume, but is going to be less specific to depending on locations and how long they wear it. So this is just an example of a week-long period of data. So this is a week, like I said, a week of data that was collected concurrently with some gait analysis at the very beginning. And this is the only, like this portion here is where they were actually in the lab. And just to give you an idea of like how different, what you're seeing in lab versus out of lab. So like which is more actually representative of function. So just to kind of tie it all together. So like our lab is our arching objective is to create a more accessible biomechanic technology with clinical framework, with the hope that we can collect a bunch of high quality data at each time point, essentially from their first consult of the clinic all the way through 12 months post-op, and like potentially be able to see the effect of different interventions before, and hopefully be able to, with all this data, be able to decide which the surgery is best for patients. And so our short-term goals among them are to establish the validity, reliability, and feasibility of using all these technologies, and in my case, using wearable sensors, which brings us to the paper. So this paper was published earlier this year. Our main objective was to evaluate the reliability of the wearable sensor data collected at multiple days in out-of-lab settings in a knee osteoarthritis population. Sub-objectives within that would be to evaluate like the waveform reliability, so like evaluating how different like the actual like signals that we're getting from patients walking that have higher degrees of variability in their gait, as well as the discrete reliability, these are the numbers that you often see with like the peak peak moments, or like peak accelerations, peak like angular velocities, stuff like that you get from wearable sensors. And I also wanted to simulate the improvements in reliability, because like I said, like you have a limited number of steps to analyze when you're in an in-lab setting, which may be somewhere between like 5 to 10. So I wanted to simulate to see if there were any improvements in reliability through an increased number of strides. So we had, like I said, we had 9 OA patients. They had 4 data collections about a week apart. We had IMU sensors attached bilaterally at the shank with it, and then we had them complete a 6-minute outdoor walk at the hospital at the outside of the clinic. In terms of analysis, we looked at digitally rotating sensors using a PCA algorithm that we had previously published, since when you place a sensor, it may not be perfectly aligned with the segment. But using a PCA algorithm when walking, one of the things that we showed in the previous paper was that we could essentially digitally rotate that sensor back to where it should be. So once we had the rotated sensor data, we segmented the signals into individual strides, and then evaluated the waveform and peak metrics for reliability. and then also tested for any kind of improvements in reliability from including more strides in the calculations. So one of the things that we wanted to evaluate, because like I said, this is from a previous paper where we were looking at differences between research placed and patient or participant placed wearable sensors as a way to evaluate an alignment algorithm using a PCA. So this plot, the black is the unrotated sensor data, and blue is the realigned sensor data, and then red is no cap. So you can see after we use the PCA algorithm that we had some pretty good improvement relative to our relative to the no cap reference data. So from this study, we saw that that with the alignment algorithm improves the validity, which leads to improved reliability. So the current study, we were able to see similar results where these improvements in reliability were also seen in an OA population. So this is just an example of kind of like the waveform reliability that I was talking about. This is an example from the frontal plane, which is can be used as a proxy for various thrust and wearable sensors. And so one of the things that we saw was because this is a noisier signal compared to like sagittal plane mechanics, but we did see that there was a reduction in the signals overall became more stable. There was a reduction in the overall and like the standard deviation across. So there was, the signals overall became more reliable as we included more strides. And then this is something that we actually ended up including for each subject. We had essentially all six channels. So we had our medial lateral, frontal plane. We just basically included like every plot that we made for this with 4 days, as well as the all the signals across there. So the main takeaways from this paper, we saw frontal plane overall was less reliable than the vertical and AP signals. However, the additional strides made it made it in the planes that were less consistent, mainly the frontal plane angular velocity, it did shrink the confidence intervals and made there'd be more agreement between the signals. So there was overall minimal improvement with the additional strides, but like whenever it was a less reliable signal, such as the frontal plane angular velocity, that we did see some improvement there. And overall, this is in pretty good agreement with the previous lab studies, but we need more additional, like truly free living, like like I said, like at the beginning, kind of like looking at this over the course of like a week or longer, or several days at least. Because this was just, like I said, like a 6-minute walk. How does this look whenever you look at it over a longer term? So that's the study. So now I'll go a little bit into like kind of like we'll call it the behind the scenes. So like one of the things I wanted to get across from this talk was that we often see the finished product, but it's often a process that you don't see like what happened behind the scenes, and it's just everyone goes through this and it's part of publishing, but like the full story I think is much more interesting. So when you're putting together a study, you might think that this is kind of like what the ideal study timeline is. So you start out, you have an idea for a study, you collect your data, you might put together a conference abstract. At some point along the way, you draft your paper and you submit it to your journal. And then at some point in the future after you submit it, gets accepted. And in reality, of course, it's much more complicated than that. So like this is where we'll jump into where things were with my study. So we had the first initial study idea, we did a little bit of pilot work. And then we had a new study idea. We collected our data, started doing data analysis in advance of a conference abstract. And so this is where we start talking about like what the original study was. So originally, the data was actually collected as part of a master student's in the lab, his research. And so he was collecting a total of actually 7 of these like 6-minute walk over the course of like, different weeks. And I was trying to hop in right before and after the knee injection, because his study was looking at variability from changes from the knee injection before and then after, and changes in pain and then function. So the hope was that we could get the in-person, send the patients home with an iPad and a couple IMUs, go for a 6-minute walk on their own when they're at home, and then return the data, and we get all this nice data to look at. So unfortunately, that didn't really work, largely because I'd say like we also had a small number of patients, so I'd say probably half of them ended up just like coming back and just saying I didn't do it, I didn't feel like it, and then there were some that thought they did it, or they couldn't get it. All told, we ended up I think with like a total of like maybe 3 people. So we're trying to put together this abstract for our for the conference, and say, okay, well, what else can we look at? So we have just put together the previous paper. We're starting to put together the previous paper, looking at the reliability from the patient place to the researcher place sensors. And so at a certain point, it was like, okay, our original idea is not going to work. What can we do that's that we can get with the data that we have? So this was the paper that we were starting to work on, and I said, okay, well, we have this data. What if we do a similar analysis and look at the reliability of like the underlying waveforms? Because like most of the research focuses on just like your outcome measures, like looking at like the discrete outcomes. Very few are looking at like the actual reliability of the data that you're getting out. So that's what ended up what we did. So we submitted for our abstract to ORSI, and got to go to Berlin for a few days, which was a lot of fun. And so we presented that abstract, attended the conference, and then I had my comps in the middle of all that, so that kind of like put a brakes on actually completing the study. And then finally got back around to data analysis after a few months of studying for comps. And then we started actually drafting the paper. And then we submitted to the journal. We initially had submitted it to Gait and Posture, but because our sample size was so small, it was rejected. They basically sat on it for 3 months and then told us that our sample size was too small. So we had to pivot to Journal of Biomechanics. After a couple months, we got our first revision back, and then a few more months, got a second revision, and we finally got our paper accepted. So I'll talk a little bit more, just a little bit about the data management, and then a little bit about the revisions that went into the paper. So wearable sensors, obviously, we're getting a lot of data. And so this is going to be like, I think one of the more interesting things with wearable sensor data is just like it's inherently going to be very, very noisy. And if you don't put it on, correctly, or, in particular, like our data set, even though because the master student was like running the study, so he was the one putting the sensors on. There were a couple that we ended up having issues with because they were flipped upside down, and so we had to figure out how to correct them and all this stuff. So so I think like one of the key things with wearable sensor data in particular is essentially getting it to like a usable format. So like taking your raw data, which is going to be varying so like ours for this particular study is 6 minutes. that's still enough data that like Excel won't really let you open it. So you really like have to like, be able to open it in a program and then take it through segmentation. So like getting it into usable usable waveforms that'll allow you to then, pull different peak metrics, different average parameters, looking at like the, step time or stride time. And so like that all, sorry. And so all of the different things that go into that. And so like, this is where we implemented our PCA algorithm. This is where we pulled all of our different metrics from. So we could very easily pull the average waveforms and then also have our average metrics for the discrete outcomes. So for me personally, like one of the things that I do whenever I'm writing a paper, I tend to organize my folders by data, so I can easily like write whatever code I need and pull all the data from that. And then I'll have like abstracts and then like in progress manuscripts. I generally try to like have everything organized from essentially like having all my raw data in one place, and then having the code to like analyze data, and then having it like basically like all the processing code, and then like finally just like all the stats related code for the paper, keeping it all together. So in terms of the revisions, there was just a couple. Most of them were, I'd say, pretty simple, like rephrasing things, adding a little bit more detail in a few spots. I'd say the biggest points that we had to do, especially for revision 1, was getting gait speed in there. And so luckily we had, because this was part of a larger study, we had a third undisclosed sensor initially that was at the waist. So because initially we were like going in circles trying to calculate gait speed off of the shank, and it's very difficult because there's never, compared to like other locations, there's never a spot where you can do like dead reckoning or something like that to easily like recalibrate your signal that'll give you an accurate like step length and gait speed. So we ended up having to pull that from our waist sensor, and then once we had that, we got our second revision, which actually led to a really interesting discussion within ourselves for the group that put together this paper, because our confidence intervals actually, because like we originally used a very conservative estimate for mean squared error, but it didn't account for repeated measures, which we didn't realize until the reviewer asked us to comment on how the confidence intervals were so small, and is this really like useful essentially. And so after we like kind of realized, okay, we're not accounting for the repeated measures, we use a simpler like method that used standard deviation, and our results came in more in line with what we expected. And I'd say overall the revisions like strengthened our paper and provided helpful confidence. Obviously that's not always the case, but like overall I'd say like it was a positive experience with that. So this is, I'll give you just to give you an idea of like the final like actual timeline. So like we started the study in 2021 in September. I was actually hadn't actually moved over to Canada at that point. I was still in the US. Everything was remote for the first semester, and so I ended up being able to move over in October. But as a result, I wasn't as involved with like the actual data collection, and things were still very closed in Canada, COVID wise at that point. So from like the original study conception to acceptance was about 2 years. Obviously, like this is, I don't want to say like exaggerated, but like like it can take this long or longer in some cases. The timing also depends obviously on the journal, and how many other things you're involved with, as a student or in your personal life, like all that kind of stuff. So I would say, just like be persistent with like getting it done as long as you're moving it forward. I think that's as much as anyone can do. So just a few lessons learned from this. I'd say number one is be flexible. Because like I said, like this was like I think this is one of the things that like doesn't really come across unless you're talking to someone like in a setting like this. Like you would never know that this wasn't our original study idea. And it actually influenced the direction of my dissertation, just like being flexible because originally we were going to do everything was going to be like self-placed sensors with the patients, and it became very evident that this wasn't going to be feasible. And so we have since pivoted and like are now placing all the sensors ourselves, but like being flexible still allowed us to get this paper published overall. Be patient but persistent. Obviously, like getting all the stuff done with all the other responsibilities as a grad student is always challenging. But like I said, you just have to like keep moving the ball forward and eventually get it over the line, which is great. And the reviews are generally helpful. I know, once again, I know that's not always the case, but like I think like overall, like we had a good experience and it really improved the quality of our paper. And then I think the most important one here is own your data, because no one's going to know your data as well as you. And this is something I try to stress to all the master students in particular in our lab, because like they don't always, you want to take ownership of your data. And it's a really important aspect of, I think, being a graduate student. In terms of tips for writing, just a few things here. So I think this is talked about often, but just to talk about it, I would say always discuss authorship and your role early. That wasn't an issue in this case. Like we were all on the same page at that point. There was literally 4 of us in the lab. Our lab is much larger now, but I've also been a part of other lab groups where that's not always the case, where there's it's assumed that you're going to be on a paper and then you're not. So just discuss it early. If you have an abstract from a conference, I highly recommend using a journal suggester such as Jane. This really helps you like find your focus in terms of like what journal you end up in and all that kind of stuff. Which brings me to the next point of looking up your journal formatting early, because every journal has its own formatting and it takes a long time to go from one to another. So like making sure that you have everything, all your ducks in a row, just like simplifies the process down the line. And then just like finally, keep an archive of your data for the specific paper along with commented code, because like I said, like all this takes a long time. So coming back to it, whether that's from revisions or you put it aside because you're studying for comps, like knowing how to like to jump back in and being like, okay, this is what I did here, this is when I ran that, okay, I got what I'm doing. Because like otherwise like it becomes a real bear to like know if you're like looking at the right data, right analyses. Like I'll slightly recommend plotting everything from the beginning, because you often need to put it together in a supplemental file anyway. So that's pretty much everything I got. Just to quickly acknowledge all of my funding and advisor and all that. So and support from my lab. So I will take any questions. So thanks for your attention, and yeah, thanks.
Thank you, Matt. I really liked you talked about the research a little bit, and then also talked about kind of the pitfalls and some tips. I know I have some questions, but I'll see if anyone else has questions first. If it looks like Daniel has a question, if you can raise your hand or just unmute, or if you're not comfortable unmuting, you can also put questions in the chat. But go ahead, Daniel.
Okay, hello. I have a question about the sensors they put on the shanks. On what side of the shank you place them? Like, was it the anterior, posterior, or medial, or lateral side?
Yeah, I'm just going to swap back to that slide real quick. Yeah, so we had it essentially just like it's on the medial side. I'll pull up the this one. So can you see my cursor?
Yes.
Okay. Yeah. So we had the sensors were placed bilaterally just below the knee, medially, medial to the tibial tuberosity. So essentially the top. So we used the activity AX6. So essentially the top of the sensor was in line medially with the tibial tuberosity. Essentially, we're trying to find like the flat part of the shank. So we're placing directly on the bone. So it's going to be stable. Even like, like people that are, like larger are going to like still, they'll have like less overall like soft artifact happening there. So it was just a stable location essentially.
Can I ask, like, why you didn't decide to put it like in the posterior part that is like the one that has the less fatty tissue, muscle, and overall it will have like the less skin movement, so it will help you to keep your frame like stationary, and it wouldn't like matter every time that you do a contraction and change a
Well,
little bit your frame.
well, that's like I think maybe it's not coming across, but like where we are placing it is on the bone. So like there generally isn't going to be much movement from contraction there. Um so like it's yeah, does that make sense? Sorry.
Yep.
Okay.
I have a question. Very nice talk. This is very cool to see all the behind the scenes. I'm interested in the timeline that you showed of, the full 2-year slog.
Yeah.
And I noticed that the abstract that you were talking about was like the very first thing that you did.
Yeah.
And I'm wondering, if you could talk a little bit about like, was that abstract, was that, your full cohort? Was that your full analysis? Like what was a massive sprint to get there? I'm curious about that process.
Yeah, so like I said, this was data that was it's kind of I say one of the nice things about the lab that we're in, it's a very collaborative space. So like the master student whose data I was hopping in on, like this was his master data that he was collecting. So it was essentially like we had like conceived the original study idea, like I said, of the like, having the self-placed sensors. And so when that didn't work out, like I was able to, pivot to using like doing a different analysis than what he was doing, which ultimately turned into this paper. But yeah, like it was like we actually just went through we just submitted to ORZ last week, and I always like tell myself like I'm not going to I was like, I'm gonna be on top of it this year, like, I'm gonna, not be like putting in something at the deadline, but like it always ends up like there's always like some kind of like hurdle that you need to like do like at the last minute. And so but yeah, it's always, I feel like it's a sprint to get to the abstract, and like getting because I like all the labs I've been in, like abstracts of course are, like using a good like checkpoint of like, okay, like we've collected all this data, like let's do an analysis, because otherwise it's easy to just like keep collecting data and never actually look at it. So like I said, like I think it's like a sprint to get to the abstract, and then like it's a marathon to get to they actually get the paper off the ground. But like because it was so, sorry, just to answer your questions here. So like so yeah, that was the full analysis. So like there was only, because it was a repeated measures, there was there was a total of 7 collections for these 9 patients. So like it was pretty intensive on their end. So like obviously we would have liked to have like more patients, and that was like part of the reason it got kicked back from gait and posture eventually. But like ultimately, like it like the data was what it was. But because of the nature of me like hopping in on someone's project. It wasn't like we were continuing collection on that. So
Hey Matt, thanks for that talk. That was really, really cool, and I liked that you had like these timeline slides in between at every point, just kind of showing the process and everything. So my question was about going from that first submission to that second submission. So kind of what you
yeah.
have up here. You had mentioned that GNP kind of sat on it for a bit and then hit you with the rejection.
Yeah.
And then I kind of had to quickly switch up gears for like formatting for the next journal.
Yeah.
Could you just talk a little bit more about that? Like that process of getting that rejection and then immediately kind of switching the gears to format and resubmit?
Yeah. Yeah, so yeah, it was kind of frustrating just because like I had like submitted essentially, because like I talked about, like I did my comps in between that. So like I essentially like the week before I started saying my comps had submitted this and we didn't hear anything. And then I think like the day that I like did my comps, I had gotten the rejection from the gait and posture, and was just like, you sat on this for 3 months and just rejected it. Cool. So like that was a bit disappointing, but is what it is. But yeah, getting it into so like that's where like having the journal selector was really handy, because like, or journal suggester rather, because like we as we had put it in there initially, and it's like, okay, like gait and posture, like that's like seems like it's a good fit, like we'll submit it there. When we got back, I think the number 2 was journal biomechanics, and so like, okay, like let's try the next one down the list essentially. And then it's just a matter of like reformatting tables and reformatting, like, because like some journals like want you to have like the continuous numbering, and some of them it's like restart every page. And like I don't know about you guys, but like I never remember like how to like turn all that stuff on. So it's just a lot of like on the back end, like Googling like just like making sure like you have like all your ducks in a row in terms of like like what are the subtle differences between, because like overall it's going to be mostly the same, but like sometimes like the sections are differently named, and like the whatever formatting is slightly different. So yeah.
Thank you.
Yeah.
Hey Matt, this was great talk. Thank you very much. I had a question about your recruitment challenges. I know that you had a lot going in now, but going forward, what advice would you have in terms of for your recruitment with your population?
Yeah, so there's a couple different layers of that, I think. So I'd say the first one would be because like we're very specific, because like like I've done a bunch of like other research, because like when it's like the running study is like we're literally like just trying to find runners to like get into the study, but like when it's a clinical study, like it's like we're like literally like in the clinic, like the surgeon like leaves the room and the patient comes in, and like we talk to them and see if they want to be in the study. And so there were some recruitment challenges just from the timing of like when we were trying to recruit originally, because like this is like still in the middle of COVID, and like I said, there was still like a fair amount of shutdown here, but like because it was a hospital, like it's still open, so like we're actually able to keep our studies going at a much higher degree compared to a lot of the other labs, a lot of similar labs, because like we were in the clinic. So in terms of like the challenges with that, like I think like having the patients like wear the sensors, and this is like something we're going through now with our current study, is just like having people like being okay with like wearing the sensor, and like because they're a lot of people like like are sorry, just 1 second. My son is coming to say goodnight. Hi.
Can you give Dad a hug and say night night?
Say night night. Night night.
What is calling?
Alright, that's who he's calling.
This is who I'm calling. And say hi. Say hi to everyone and wave.
Say night night.
Say night night. Okay.
Get up, let's go read some books.
Yeah, that was come.
Sorry about that. So yeah, so like I think like the biggest challenge is just like overall is just like having people being okay wear the sensors. Because like some people, because like we've had people wear them because they're like worried that they're going to like, you know, interfere their walking, or like they don't like the way, because like now we're using like adhesive stickers to stick them on. So like some people like don't like the look of that, or like, you know, like one guy I think recently rejected because he said, you know, like, oh, I don't want to like I'm a farmer and like I'm worried about like them falling off when I'm farming. And so, you know, it is what it is. And then specifically within like the context of the original study, we were going to try to like have people like wear the sensors and like self-place at home. Because like that was like I said, the original focus of the study. It just was ended up not being feasible, in part because it was a because like, you know, like we as researchers like understand like how to like, you know, place the sensors and like, you know, start up like, you know, because these were eye measure use sensors, so it's like, you know, interfacing with like the iPad and all that stuff. But older adults don't necessarily like have that. I'm not saying that they can't, but like it's harder for them. And talking to other researchers that do similar research, like that's a pretty common theme, I'd say. So just like understanding like, you know, I would say like the limitations of like the study population, but like trying to meet them where they are. And so that's where we ended up, like we're replacing the sensors with adhesive tape like now, and like just like leaving them on for a week. So it's, and they don't have to do anything except take them off like a week later. So I'd say just like recognizing like where limitations and opportunities are.
Great, thanks.
Matt, there is a question in the chat. It is, did you learn a lot from your presentation? Oh, this person did learn a lot from your presentation. They have a question about the sensor. I'm not quite familiar with the algorithm. Will different placement of the sensor impact the accuracy / reliability, or will different heights of sensor placement, i.e. different lengths of the shank, impact reliability as well? Thanks.
Yeah, that's a great question. So the different placements of the sensor will impact the accuracy. Like I said, so like I wish I had included it. I had it in my my proposal a couple months ago, but like there's a great figure that like shows essentially like all of the different placements and like the different measures that are like common in research for OA. Shank is actually the most common. But like in terms of like sensor placement for depending on like what you're looking for, like there may be better locations. So like getting things like spatial temporal parameters are much easier from other locations, such as, you know, either on the foot or on the waist or somewhere on the torso. And so we decided on the shank because like we could get specifically because we were also interested in like measures of like varus thrust, which you can't get from other sensor locations. But we in theory we should be able to get like we should be able to get those measures of like spatial temporal parameters and stuff like that out of there. So but like I said, like we liked our location because like it isn't on soft tissue. So like if we, and like there are other studies that have like looked at, you know, the impact of location. I think that's fairly well studied, I'd say. A lot of places like put them on the thigh, but like there's no like really like, I don't think there's a great location to put on the thigh just because it's there's a lot of like muscle and soft tissue, so you're gonna have more movement artifact there compared to other locations. As far as the height of the sensor placement, I don't know if that'll necessarily impact the reliability so much as long as it's consistent. I think like for like one patient, like it's or like one subject, like it should be fairly reliable. I don't think it necessarily, like I said, I don't think it necessarily reflects reliability, but it could reflect or could impact it if it like varies. So if you like place it lower versus higher, like you're probably going to get different numbers.
Hey Matt, my name's John. I enjoyed your talk.
Nice.
I have some questions. I have a question about learning to use the IMUs in general.
Yeah.
It sounded like you already had some experience with IMUs from your time working with the runners.
Mm.
But coming into my PhD, I had no experience implementing IMUs or wearable sensors, and nobody in my lab does either.
Yeah.
We're using exit sensors, but
Yeah.
just can you talk a little bit about getting used to using new technology? It doesn't have to be sensors exactly. It sounds like you're getting into computer vision as well.
Yeah.
But selfishly, I'd like to hear a little bit about how you just like navigated that path of the IMUs learning to use the tech that not a lot of people have information on.
Yeah. That's a good question. So like the fuller story. So like, I talked a little bit about my background here. So like this is like the nice simple timeline, right? The full story is that like I was like also like in the midst of like trying to get like other jobs before I decided to come back for my PhD. And part of the reason I came back for my PhD was because like like I said, like I had the experience with wearable sensors at with the running when I was doing the running research, and then did a little bit more kind of like self-directed research at Henry Ford, doing shoulder research because there's not a ton with wearable sensors in that area. But like I really my dream at the time was to I really wanted to like work for like someone like Nike or a shoe company or something like that. And I just got completely burnt out trying to get those types of jobs because there's not a ton of them and everyone's super qualified. Um, and so at a certain point, like I decided, like, okay, like maybe I can, pivot to something else. Like, I kind of like looked at my resume and say, okay, like I did a little bit of work with wearable sensors. I applied to a couple like wearable sensor type companies and realized like I don't know like near as much as I need to get a job. And so that's how I like decided to come back for a PhD. Um, and so a lot of it honestly was just, especially a lot of the stuff I did with Henry Ford with like rotator cuffs because like that was where I really like started to like delve into like the numbers and like try to like get like the metrics out. And honestly, like just playing around with like sensors like is like the best thing you can do if you're like really whatever, just like play around with it, like see like where things seem to make sense, like seem like like start with like the basics, um like we were doing like really basic stuff like what's like just like the base like frequency for like if we just like leave it on like a bench for a couple days, like what's the base like noise level, like just to see like what kind of stuff we would get out of it, like just play around with it, I would say. The other thing I would say like with like just like getting used to new technology is like at the end of the day it's a technology, and a lot of people are going to probably know how to use it at a decent level. So like knowing like understanding the data that's coming out is going to be like most important. And so like right now like we're doing a lot of stuff with the markerless motion capture, and like that stuff is really fascinating, but like at the end of the day, like as a biomechanist, like we like want to know like how reliable is that data and like how like valid is that data. And so like we're just trying to like we're like trying to like essentially break it and see like where the weaknesses are, where the strengths are, and just like understanding like the data that's coming out of it.
Awesome, thank you.
Yeah.
Matt, can you talk about how you identify, like you had so much data, how you extracted the actual walking parts from it?
Yeah. So for this data, Let's see if I can find. Yeah, so like this data was so like the example here is like from our like week data, so like that's very different. But the data for this study in particular, because it was a 6-minute walk, like they basically put the sensors on and then like walked out to the courtyard, or they might put them on the courtyard. I don't remember. But like as in any case, they put the sensors on, they did their 6-minute walk, and then the sensors came off. So like the average like length of the try was like maybe 10 minutes. So like really the trick was like identifying like where the 6-minute walk was like actually starting. So like basically just like kind of searching the signal for like the first like essentially like trying to find like the dead period before, whether they had been put on and started, or if they like walked to the courtyard to do it. Basically trying to find like the quiet part in the signal where like it's like, okay, they're clearly standing here, they're waiting to start, okay, now they're moving, and it's just continuous walking for 6 minutes. For that, it's fairly simple to like I think I was basically like looking for essentially like the end of like the quiet part of the signal. And then but like when it's like something like our data now where we have like a week of data, we're currently using like some heuristic methods of like using like frequency to identify like walking bouts. So that's what this is that's highlighting here. So like we didn't have to do that for this data just because like I said, it's 6 minutes of walking, so it's pretty easy to like see like where that starts and stops. But like when you have a week of data and they're out of lab and you don't know what they're doing, so like I said, we use a frequency based algorithm for that. We're working on a machine learning model using like a LSTM, but we haven't implemented that yet.
Okay, that makes sense. Thank you. And then to separate each step, like from the 6-minute walk test, did you guys have to develop a new algorithm, or did you use one already that was established?
We use established ones, yeah. So we used should know the reference. There was can't remember the name of the paper. It was by Mariani. Like they had like basically like used a bunch of like pressure mats or pressure insoles in conjunction with IMUs, and like may have had motion capture, and basically like identified like okay, like here is like the walking signal, like this is like where like the like this point in the signal is like where the pressure sensor would indicate is walking. This is where, or like this is like where it would say like this is heel strike and toe off, versus like the the angular velocity versus acceleration, and like just kind of like so you could see like where in the signal like you should be looking more or less. So like we use that kind of as a basis for our gait segmentation for like once we like had that like okay, here's the 6 minutes, now we're going to like find where those starts and stops are.
Thank you. I'm going to pause, or I'm going to stop the recording in case anyone wants to ask any questions off recording.